Good morning. This is Dr. Timothy Scott Beck. It's August the 26th of 2024, and I am blessed to be here this morning. And we're doing our best to accommodate people today, and we want to hear from you if you're sick or you're having problems. Okay, so we can get you taken care of as quick as humanly possible. All right. Just a general announcement. Next Monday is Labor Day, so the office will not be open on that day. Okay, we'll be back Tuesday, full swing. But just wanted to let everybody know that Monday we will not be here. For that. The other thing is, if you guys noticed here in the office, we all of our seasonal workers left. We had a bunch of folks, young people, here for the summertime, and just to give you an idea of what goes on there. So I volunteer to help people learn about medicine. And I love getting these like nursing students and things in because I can really give them some great experience up front so that they'll feel better about interacting with patients and stuff as they go through their training. So we had a bunch of those this summer. Not like I say, I like those being around because they're smart people, they're intelligent, and I'm able to help them a little bit, and they help me a little bit. So hate to see them go, but I also like to see them out there, moving their careers along and doing something for themselves, which is pretty cool. So medically, let's talk about something this morning. Occasionally, well, not occasionally, it's quite frequently, we get patients who are dizzy. All right. And so typically when we have a dizzy patient or a patient who is complaining of dizziness, the first thing we want to do is make sure they're okay. And then the second thing we want to do is actually see them in person. So dizziness comes in many forms. The two most common forms that we see here, number one is dizziness that people get when they go from sitting to standing or from lying to sitting, okay? And that's called orthostatic hypotension. And that causes that swimmy head and makes people feel bad or feel unsteady. And sometimes it can even make people pass out. Okay, that's usually what happens before people pass out. So that's one kind of dizziness. And if you've got that kind of dizziness, I tell everybody before you do anything, go drink a quart of water, to make sure you're okay from that standpoint. But the other type of dizziness we get is we call benign positional vertigo, which is a lot different than the orthostatic blood pressure. It happens when you lay down, not when you stand up. And it can be quite severe. And usually it's when you're laying in bed and you flip over and the room just starts spinning out of control, or if you look the wrong way and it starts spinning out of control. Sometimes it can be triggered by something just as simple as stepping off a curb, and it sends your head into a thing. And what it is, your head's getting mixed signals. It's your ears tell your head you're going one way, and your eyes say, hey, no, actually we're going this way, and you get this weird eye stuff. So that's the stuff that we can evaluate and look at here in the office. And we have ways we can fix that. We have medicines, we have therapy that we use for that, and we have exercises, different things you can do for that. So those are two forms of dizziness. I've been dealing with dizziness for 20 years now. And it is, it's very common. I've experienced both of those myself, so at least I can relate a little bit to what's going on. But anyway, if you're feeling dizzy or you feel like you're dizzy sometimes and you're not sometimes, whatever it is, please come and see us and let us talk to you. Let us evaluate you. Let's let you see. The thing now that we don't ever want to happen is we don't want you to fall, okay? Dizziness and falls, of course, would come together. So, if you're feeling dizzy, you're feeling unsteady on your feet, we definitely want to see you. We want to hear from you. We do not want you to fall, and we want you to be real careful till you can get up here to see us. There's some other causes of dizziness that I'm not going to get into today because it's a laundry list of things. And those are things that we try to make sure haven't happened when you come in here for dizziness. Like you got Meniere's disease, you got strokes, you got all kind of things, other things that could happen. But I'm just giving you the two most common type. All righty, listen, we had a great weekend. I hope you did too. The weather's beautiful. It's a bit dry, but it was actually beautiful this weekend, like really beautiful. But anyway, we're back to work today, and we want to hear from you. If you got any problems, our number 706-782-0016. Remember, we're in the business of seeing and helping people, so we really want to try to do the best we can for you, okay? Thank you so much for listening to me. Call us if you need us. Have a great day.